Welcome, ma'am. Good afternoon. I am Abhinav Rawat from Veloxx Media, and we have with us Bhavna Shinde ji, who is an advisor to SETU Aayog, which is a policy think tank for the government of Uttarakhand. So, ma'am, first of all, the question always comes: what is exactly a policy think tank, government policy think tank, like what SETU Aayog is? If you could explain that.
Thanks, Abhinav, for having me here. And I would like to just talk a little bit on what SETU Aayog is. So, SETU Aayog is a state counterpart for NITI Aayog, and we replaced the Planning Commission in Uttarakhand. If you look at the policy think tank of government, basically the idea behind is to bring about reforms in the policy and also some kind of innovation. So when SETU Aayog started 2 years back, the idea was that how could we evolve and also bring about some kind of changes in the policies that have been running at the state level. So we started with a mandate of policy reforms, but how do we really work towards the policy reforms as a think tank? One thing that we look at is how do we create evidence-based policies, and for those collecting those evidences and creating those evidences, we do a lot of pilot initiatives, and these pilot initiatives are done with partners from the government, like the government departments. Then we have industry partners, we have private partners working in the social sector, and also the civil sector community or the civil society. So that is how we have been working on policy reforms. Again, if I'll summarize it, we are creating evidences through pilots, and pilots are done with different stakeholders. SETU has been working in a lot of areas, and healthcare is one of them. Last year, when we started discussing with the health department, we could identify some of the priorities on which we wanted to work. So that is how we are working till now as a state think tank.
Thank you, ma'am. You mentioned about pilot projects that you work with civil society organizations, private institutions as well. So I just wanted to understand as to what pilots have you been running. If you can mention a few of success stories and what pilots, in primarily maybe in the health sector space, if you could mention them, and maybe like other success stories in maybe like other departments as well. If you could mention a few, so that people would understand as to how basically SETU Aayog works.
So we started discussing with the health department, and we came to realize that there were some priority areas where the department also wanted to bring about a change. And once we identified those areas, we started looking for private partners who are working in that sector, and also some of the organizations which were prominent organizations like AIMS, Rishikesh, and then there were organizations like Aditya Birla Group. We had Hans Foundation, we had Vadhwani AI. All these organizations have been working in the health sector in Uttarakhand as well. So we had discussions with them, and we identified few projects which we have not started yet. We'll be starting very soon, but some of them are into mental health. Then we have menstrual hygiene and health for adolescent girls especially. Then we are working on the nutrition factors of pregnant women and infants to reduce the infant mortality rate and the maternity mortality rate. Then we are also working on projects like policy reforms for creating public health management cadre, and how do we create good models of PPP so that the health can reach to the remotest location. So as of now, we have not started any pilot, but we have identified these areas, and we have started working on conceptualizing how we'll actually bring them to the field.
Thank you, ma'am. Thank you for the update, and I believe good things are about to come since Bhavna ji mentioned the government of Uttarakhand, with the government of Uttarakhand, they're planning to start a few projects. So in that, I believe in that progression, I believe Himalayan Healthcare Innovation Summit was somehow conceptualized in some ways, and Veloxx Media and SETU Aayog partnered, and SETU Aayog is basically the strategic policy partner for Himalayan Healthcare Innovation Summit. Ma'am, could you like briefly mention as to how exactly was this envisioned, and what was the idea behind it, and how were the panels designed in some ways?
So I think we partnered with Veloxx last year also when you all did this healthcare summit in 2025. So this year when we all met and we realized that the healthcare issues and challenges are similar across the Himalayan states, and we wanted to bring in voices from the other states also in order to maybe substantiate our understanding of the healthcare system in the hilly region. So we found that this is a really good idea to bring in other states as well. So that's how we got on this idea of a pan-Himalayan healthcare innovation. As in about designing the session, as I mentioned to you earlier as well, that we had been discussing with the department since quite some time, and we had identified these priorities in the state. So based on that only, we had suggested that we could take up these discussions and we'll get maybe some more insights from the other states as well, which could substantiate the work that we have been doing.
Thank you, ma'am. Thank you for your inputs. And I believe, based on the agenda that you might have seen, that the Himalayan Healthcare Innovation Summit has, like we have topics that cover AI, we have topics that cover mental health, menstrual hygiene, women's health, and PPP mode, and diverse other topics were also, I believe, covered under these panels as well, because we have had expertise from diverse expertise. So I believe it was through your strategic inputs and through your strategic expertise, I believe this has been a wholesome experience being part of this, and I believe this is going to, and we will certainly continue with these conversations and hoping to create shorter, more concise forums wherein we can expand on these specific panels that we have created, and we can create a healthcare ecosystem that would in the end deliver outcomes that would help healthcare across the pan-Himalayan regions and across India. Thank you, ma'am. Thank you for coming, and thank you for all your inputs.
And I'd like to thank you again and also congratulate you for this second round, and we hope that we'll do it next year as well. Thank you.